Welcome to our second episode titled Freedom of Religion or Belief, COVID-19 and Humanity as part of our COVID-19 Religion and Belief webinar series. Today we're very excited to have some very special guests with us, which I will introduce very quickly. My name is Francesco Di Lillo. I'm the Director of the European Union Office of the Church of Jesus Christ of Latter-day Saints, and one of the hosts and sponsoring institutions of this webinar series. Before I introduce the Evelina Ochab, who will be the moderator of this panel, I would just like to give you some technical information. First of all, the meeting is recorded, and the recording will also be shared afterwards through our post-meeting reports, either on the landing page of the webinar series or through our newsletters. You can see us, you can hear us, but we cannot see or hear you. However, you are more than welcome to use the Q&A tool that you will see on the bottom of the page. The Q&A will allow you to ask questions, and these questions will be either answered live by our speakers or in typing. Please keep in mind that if by any chance you are kicked out of the webinar, or if the connection is lost, you can still use the same link that you used to join to reconnect. We'll make sure that the webinar goes on. So without further ado, let me introduce you Evelina Ochab, who will be chairing and moderating this panel. Evelina is a human rights advocate and co-founder of the Coalition for Genocide Response. Ochab authored the initiative and proposal to establish the UN International Day commemorating the victims of acts of violence based on religion or belief, marked on August 22. She's a dear friend, and we look forward to hear from her. Evelina.
Thank you. I would like to join Francesco in welcoming you to this webinar on religion and belief, COVID-19 and human dignity. You will hear from distinguished experts on religious freedom and human rights, and indeed human dignity. And it's a great pleasure to moderate this panel. And I would like to thank Francesco and Pascale for all your hard work in organizing this webinar. But before I give the floor to the panelists, I wanted to provide some narrative to our conversations today. Understandably, the overreaching narrative is COVID-19, a pandemic that has been shaping or reshaping our lives over the recent weeks and months. However, there are particular visuals I wanted to paint in your minds, especially where COVID-19 meets freedom of religion and belief, meets human dignity. And this is just a summary of few headlines from the last few days or weeks. In many parts of the world, religious minorities will suffer more than others because of their religious minority status. That affects their access to basic services, whether medical or social care, access to food, or other services that they may need. For example, in Pakistan, the US Commission on International Religious Freedom reports that food aid is being denied to Hindus and Christians amid the spread of COVID-19. And as the US Ambassador at Large for International Religious Freedom, Sam Brownback, emphasized, religious minorities are sometimes blamed for the spread of COVID-19 and marginalized as a result. This is certainly the case in the case of Muslim minorities in India. In many parts of the world, prisoners of conscience, namely those imprisoned for the mere practicing their faith, are at high risk of getting COVID-19 in the dire prison conditions, where they also will not be provided with basic medical care. And this concern is relevant not only in cases of traditional prisons as we know them, but also in the case of so-called re-education camps, as those for the Uyghur Muslims in China. And as the COVID-19 lockdown continues, it brings fresh dangers to vulnerable communities, including the religious minorities in Nigeria. And as Open Doors reports, Nigerian Christians are being increasingly targeted in opportunistic attacks by militias. Similarly, Aid to the Church in Need reports that Boko Haram and Fulanis have intensified their attacks against Christians in Burkina Faso, Nigeria, and Mozambique, during this lockdown. And these are just few examples. And there are a few more cases that I would like you to keep in mind. And indeed, there are other groups that are particularly vulnerable to this pandemic, affecting their human dignity, including the elderly and vulnerable members of our society. And I'm sure that you have heard some of the narratives that ultimately deem their lives expendable. The narratives that, for example, COVID-19 affects only the elderly, so we should continue business as usual, or governments telling us that we should prepare ourselves to lose our loved ones without proposing decisive steps how to protect those most vulnerable members of the society. The narratives that many vulnerable people may not be admitted to hospitals for treatment if they contract the virus. And some care homes ask to check they have resuscitation orders on every patient or ask to obtain them. And last visual for you from New York, hundreds of bodies are waiting in refrigerated lorries to be buried in specially prepared mass graves. These are only a few situations for you to keep in mind during this webinar and during our discussions. In all those cases, human dignity is affected in various ways to various degrees. In the majority of those cases, the issue of religion or belief is engaged as well. And all those cases should make us ask a few important questions. Namely, what is human dignity? What is the link between freedom of religion, belief, and human dignity? And how COVID-19 could affect human dignity? And also, as a follow-up question, it is important to consider how can we protect human dignity? And among others, considering the great speakers that we have today on this panel, the very important question is how the Punta del Este Declaration that a number of us have worked on could assist in protecting human dignity of everyone everywhere, especially during such challenging and uncertain times as we are facing right now. And now, without any further ado, I would like to introduce our first panelist, Jan Figel, former European Commission's Special Envoy for the Protection of Freedom of Religion Belief outside of the European Union, and as I often call him, one of the founding fathers of the Punta del Este Declaration. Jan, the floor is yours.
Thank you, Evelina, and thanks to my colleagues, partners, friends, collaborators on the important topic of religious freedom or freedom of religion or belief, human dignity, and current crisis around COVID-19. Each crisis can lead us into solutions which get people more mature or more responsible or ready for future, or if not, we can get into dramas or conflicts or even tragedies, as in the 20th century we could witness. So this crisis should be really used, not abused or misused, as important opportunity to realize that we are vulnerable, that we are one human mankind, human family, interdependent and vulnerable. And dignity of human person is the basic concept, is the defining point for all human rights. And if we want to achieve 21st century with more peace, with more humane relationships, it's about justice for all. And if justice for all is to be achieved, it means human rights respected for all. And the core and the base and the criterion and objective of all this talk and struggle is human dignity, to be known, understood, respected, and promoted. So I'm glad that with colleagues and many other experts, professors, now we can work together on this important topic. But of course, we need to deliver fruits. And therefore, intergovernmental cooperation, civil society, faith-based organizations involved in protection and promotion of human dignity for everyone, everywhere, is a major issue. I think it's important point, not only because I say, but from historical and current perspective, I see that, for example, this is the convergence point or place where both religious and secular humanists can and should meet, not to divide, not to live or fight in conflicts, but to see convergence of important policies, programs, projects, and efforts. Secondly, I found out in my experience of special EU envoy for freedom of religion or belief outside of European Union that human dignity is really a common denominator for major religious traditions, namely, for example, for Christianity, Judaism, Islam. They basically represent not only Abrahamic traditions, but majority of the current world population. And so I was witnessing and promoting this concept, and it was very helpful to see how different, not only traditions, but problems of the past can be addressed through understanding of human dignity, which is crucial and important for all, for different traditions. And I mean also Eastern communities in Asia or other parts of the world. And last not least, I believe that through freedom of thought, freedom of conscience, freedom to believe or not to believe, we can address needs of believers and non-believers, that this is the deepest expression of human freedom. And when this freedom is well understood, respected, and promoted, then we can really enjoy other rights, which we can list like freedom of expression, freedom of opinion, freedom of assembly, freedom of association. So religious freedom is a core value, is a litmus test for other human rights. Respect of human dignity for everyone, everywhere is very important criterion of policies or actions. It's departure point and also objective of these policies. So this is basically understanding and concept of human dignity, which actually is foundational principle of human rights. And if we get closer to this core issue, I think we can get closer to human needs, including needs in the specific difficult time of medical crisis.
Thank you, Jan. And I would like to give the floor to our second speaker, Professor Brett Shafts, Rex E. Lee Chair and Professor of Law at J. Reuben Clark Law School and Director of the International Center for Law and Religious Studies at Brigham Young University Law School, and of course the second founding father of the Punta del Este Declaration. Brett, the floor is yours.
Thank you, Evelina. Heartfelt thanks to everyone who's joining this webinar from around the world. We know your time is precious and we hope this will be worthwhile. Can human dignity help heal us in our coronavirus moment? First, I want to make clear there are no magic wands in figuring out how to respond to the global medical and economic pandemic that is coronavirus. We are learning as we are going. There is much to be said and there is more to be done. But I believe there is something useful in looking to our existing resources, especially when we are in the midst of a crisis, as opposed to before and after a crisis when we have more time and capacity for institutional design and redesign. For example, I find myself returning to the words of the Apostle Paul in Corinthians 13, where he speaks so movingly about charity or pure love as embodied by Jesus Christ. He speaks of long-suffering, envying not, humility, being not easily provoked, endurance, seeking truth, and above all, faith, hope, and charity, with the greatest of these being godlike love, or what the King James Bible translates as charity. Another existing resource our topic today is human dignity of all people, at all times, and in all places. Consider the concepts, fundamental values, and norms that were articulated at the end of World War II, at the beginning of the human rights era. The men and women who drafted the Universal Declaration of Human Rights identified human dignity as the central concept that serves as the foundation for human rights. As Jan said, the end goal or the telos of human rights, and also as the metric for measuring success in the implementation and realization of human rights. Many of the drafters of the UDHR had personal memories of the global influenza pandemic of 1918 through 19 that killed as many as 60 million people worldwide. Not to mention personal memories of World War I and the much more recently immediate memories of the harrowing experiences of World War II. If there was one attitude that prevailed over all others, it was the simple declaration, prayer, and plea, never again. But these were not starry-eyed idealists, but they were idealists nonetheless, with sober and hard-earned understanding that it would take an articulation of ideals that were genuinely universal and deeply normatively attractive, even true, to be the foundational principle of human rights. Thus, it is not accidental, nor is it unimportant, that the preamble of the Universal Declaration begins with a recognition that, quote, the inherent dignity and of the equal and inalienable rights of all members of the human family is the foundation of freedom, justice, and peace in the world. And it is not accidental, nor is it unimportant, that Article 1 of the UDHR begins by proclaiming that all human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards one another in a spirit of brotherhood. I have found myself asking the question, is human dignity for everyone a true and useful principle at this time of crisis? Consider with me two truisms that we've been hearing a lot lately. Truisms that are both true and not, and thus can be a source of consternation as well as consolation. First truism, we're all in this together. This is quite literally true. By its nature, a global pandemic is something that affects all of us, and the coronavirus is an invisible foe that is ruthless and relentless. But we also see that the coronavirus does not hit all countries, communities, or people equally. As Evelina noted, the impacts on some communities and individuals have varied dramatically. Consider basic guidelines. Consider physical distancing, sometimes called social distancing, sheltering in place, staying indoors, and keeping a physical distance of at least 2 meters. This is sound medical advice. But doing this is much more difficult for some than for others, including people who live in crowded conditions, often with multiple generations in confined quarters, or people who don't have homes at all, or people who depend upon public transportation rather than private automobiles, and people who work in high-risk jobs, including both doctors and janitors who work at hospitals, or those who live with people who come home from such high-risk jobs. Human dignity for everyone everywhere reminds us that while we are in this together, the coronavirus affects some of us differently. There is something remarkable about the sacrifices being made to help prevent the infection from spreading so quickly and broadly that it overwhelms our healthcare systems. For the young and healthy, being vigilant is a way of not only serving one's own self-interest, but also of taking into account the interests of those who are not young and not healthy. It is not difficult to identify places, physical locations of significant concern. Evelina mentioned several of these: refugee camps and detention centers. Consider the refugee camps in Jordan with millions of people, or the camps interring Uyghur Muslims in China, or the Rohingya people in Bangladesh. Consider those in prisons, including prisoners of conscience, and those in densely packed urban centers in large cities. Human dignity, as I said, is not a magic wand that will solve the problems in all of these places, but I believe it is the set of lenses through which we should be viewing the problems. Here's my second truism. The coronavirus does not discriminate. This is also true in very important ways. The coronavirus is not a social construct. It is a biological reality. It follows natural laws, showing no favoritism. But we also see clearly that the coronavirus does not affect everyone equally. Many who are affected are asymptomatic. Recently, I read as many as 80% of those infected may not even realize they are carrying the virus, but they can transmit it to others who might get very sick or even die. Or those with pre-existing conditions are especially vulnerable. Those who are immunocompromised, those with asthma or other lung disease, those with conditions such as hypertension, high blood pressure, heart disease, diabetes, active cancer, kidney disease, those who have suffered a stroke or dementia, or chronic liver disease, or those who are obese or HIV positive. Consider those who are older. To me, one of the brutal aspects of coronavirus is how the likelihood of death seems to increase dramatically for each decade older a person is. Men seem more likely to get extremely sick and die than women. Healthcare workers are especially vulnerable, working on the front lines of exposure. This includes nurses, as well as doctors, as well as orderlies and housekeeping staff. But consider also others providing essential services at heightened risk: police, fire, EMTs, and those who help provide the infrastructure of daily life, often in low status and low paying occupations. The garbage collectors, warehouse workers, delivery people, cashiers, people working in the food supply chain. In many places, those who belong to racial or ethnic minorities are often much more likely to be harmed or killed by coronavirus, often reflecting deep social and economic inequities that predate the current crisis. Of course, the list could go on. My point is that sheltering in place, while a hardship, is also a luxury. Those of us who can stay home, teach online from home, join a Zoom conference or webinar as a replacement for in-person meetings, are relatively well off during a time of immense difficulty. The language of discrimination may not be very helpful in the face of a global health pandemic such as coronavirus, but the idea of disparate impact is helpful. The virus may not discriminate, but our social and economic realities may result in effects that are very different. This brings me to the Punta del Este Declaration. In light of the constraints of time, I would like to focus on just one sentence from the preamble of the Punta del Este Declaration on human dignity for everyone, everywhere. I've asked Francesco to put a link to a website, dignityforeveryone.org, and also a copy of this brochure. If any of you don't get it and would like one, just shoot me an email. The Punta del Este Declaration was a group of scholars, human rights activists, politicians from around the world who gathered to commemorate the 70th anniversary of the adoption of the Universal Declaration of Human Rights. And we did this by acknowledging the central role that human dignity played in the successful drafting of the UDHR and the many uses that human dignity plays even today. I sometimes describe it as the Swiss Army knife of human rights instruments. It has a preamble and 10 articles, And this morning, this afternoon for many of you, I would like to focus on just one sentence of the preamble. Approximately at the midway point of the preamble to the Punta del Este Declaration, it says this: recognizing that the concept of human dignity emphasizes the uniqueness and irreplaceability of every human being, that it implies a right of each individual to find and define the meanings of his or her own life, that human dignity presupposes respect for pluralism and difference, and that it carries with it the responsibility to honor the dignity of everyone. I believe nearly every aspect of this sentence is meaningful in our current situation. First, it speaks of the uniqueness and irreplaceability of every human being. It is important to remember that there are individual human beings that lay behind the statistics that fill our television screens and the charts that we, including me, obsess over. Next, human dignity implies a right of each individual to find and define the meanings of his or her own life. At this time, we must be careful to try to respect individuals, including those at the portals of death. We must try to find humane ways to afford connections, even when physical separation is required. Next, human dignity presupposes respect for pluralism and difference. We are seeing this in the ways individuals, communities, and even nations respond to the challenges of the coronavirus. Finally, we have a responsibility to honor the dignity of everyone, not just the old or the young, not just the rich or the poor, not just the healthy or those with pre-existing conditions. The most important part of the Punta del Este Declaration, we might suppose, are the words human dignity, and I would not disagree. But equally important is the idea of and for everyone, everywhere. The most important thing that a human rights perspective can afford us at a time like this is a passionate insistence that every person matters, all people in all places. This, of course, is a time of high political divisiveness. The crisis is unfolding in the United States just as the presidential primaries are finishing and we are gearing up for a general election. The impulses to politicize this crisis are difficult to resist. Whether, or more pointedly, the extent to which we rise to this challenge will define this moment, and it will define us in it. Focusing on human dignity for everyone everywhere is a way to try to avoid the over-politicization of our time. In the 2 years I have spent working on this human dignity project, there are two things that stand out most clearly in my mind. The first is the generative character of human dignity. Jan mentioned this as an area where common ground can be found. Almost everyone has something interesting and insightful to add to our understanding of this concept, which is at once simple and clear, but which is also rich and thick. Second, human dignity tends to elevate rather than degrade conversations. Most political concepts become divisive quickly. It is possible that human dignity becomes divisive as well, but this idea, human dignity for everyone everywhere, I believe, has a greater prospect for elevating our discourse than any other comparable concept. And so I conclude by noting that I hope the generative and elevating character of human dignity for everyone everywhere can help us as we navigate these difficult times. Thank you.
Thank you, Brett. And now I would like to give the floor to our third speaker, Professor Marco Ventura, professor at the Department of Law at the University of Siena and the director of the Center for Religious Studies of the Foundation Bruno Kessler in Trent, Italy. Marco, the floor is yours.
Thank you, Evelina. Thank you, everybody. And it's again a pleasure to be with you and an opportunity to share a few thoughts and in fact a few concerns. And I will use this intervention to highlight two concerns, in fact, and which is also a way to point into directions. One is, might not be obvious, frankly, but as an academic, I feel strongly and passionately about this, and that's dignity needs knowledge. And we experience this very strongly during this crisis. The first reason is that we have a strong feeling about not knowing enough. There's a lot which is unknown. And the second reason is that there's a lot of data, a lot of information, which doesn't help, which is difficult to understand, which is difficult to analyze, very often inaccurate, including scientific information, including scientific data. Well, this is a great reminder to all of us that knowledge is the first step. And knowledge helps in many different respects. And when it comes to religion, of course, knowledge about religion is a great priority in the crisis and beyond the crisis. Many of us, if not all of us, have been involved in various instances in projects against religious illiteracy. Okay? Now, the fight for religious literacy and the fight for gaining better knowledge about religion is not confined to religion strictly understood. It's a struggle for better knowledge in society at large, and we need this more than ever in order to understand what's going on, and in order to interpret what's going on, and in order to shape our vision and to take steps for the future. So dignity is based on knowledge and the need to know better, including, well, this is quite a challenge, I admit, including when we are faced with gross violations of freedom of religion or belief. Even in that case, as we expose those, we also need to understand the context. We also need to understand what's going on. We also need to avoid being selective. We need to be balanced. We need to improve and share our information and check our information. And this is all, again, of extreme relevance at this time. Now, my second point is that if dignity needs knowledge, dignity, of course, also needs action, needs sound action. And there are many possible levels of action. Let me point at the importance today of international cooperation, and in particular at religious mobilization beyond national borders, and in particular interfaith dialogue, interfaith cooperation. Let me stress here a point which might not be obvious as we speak of religion or belief, freedom of religion or belief, that we need believers and non-believers on board in our common action. Someone in our Q&A mentioned, I think Claude is the name, free thinkers. And something which is extremely positive about the dialogue framed within the European Union is that, thanks to the Treaty of Lisbon, atheists, humanists, agnostics are fully on board in the conversation. So this is a time for mobilization and dialogue beyond any possible any possible borders. Now, one point to finish with this, bridging the two levels, the dignity as knowledge and dignity as action, is the challenge of digital surveillance, digital security, and digital insecurity. Someone asked the question in the Q&A about this. We're all aware that this was already a problem for freedom of religious belief before the crisis. We all know that the crisis has exposed the importance of this means, which can save lives, but also has increased the danger that these means might be turned against believers and non-believers alike. So this is a very special angle and a crucial angle that we need to tackle, where human dignity is absolutely at stake. Let me mention that this crisis comes at a time when the European Union has published a white paper on how to engage with artificial intelligence, and we are particularly committed in the center that I'm director of in Trento, Fondazione Kester, on working about freedom of religion or belief and artificial intelligence. But this is a great case, and this is a great frame where the mobilization of knowledge and the mobilization of action based on human dignity are much needed at this time. Thank you.
Thank you, Marco. And now we'll proceed to the second part of this webinar, which is answers and questions time. And I tried to pick some of the questions that were sent to us in advance, and some of them that appeared in the question and answer box. And I think I would like to start with a question, and to some extent referring to what Brett mentioned during his presentation, that coronavirus does not discriminate. But of course, we have seen a number of cases where people are being discriminated against, and of course that's because of their religion or belief, not because of coronavirus. But considering that we see here that human dignity, religious freedom, and COVID-19 are all meeting, the question is, how can we address them? And specifically, what is the main policy or action specifically for freedom of religion belief advocates that should be calling for in relation to COVID-19? And I would like, maybe in the first instance, Jan to answer this question, especially from his experience of dealing with the European Union. It could be on the domestic, regional, international level.
Yeah. Thank you for the question. I think, and I said at the beginning that there is a road out or way out from each crisis, but we need to employ understanding of common good, interdependence, and combine solutions which are based on common sense and living conscience. These two, common sense and living conscience. Because this issue now, this problem, this crisis is really global. It's pandemic, and does not differentiate whether we speak about majorities, minorities, rich or poor people. And we need to realize that this interdependence is a direct call, for example, within the European Union, for reasonable solutions, solidarity within and outside, for seeking solutions which, from medical point of view, but also from economic and social, even financial point of view, would make us stronger. This crisis is just one of many in the history, but it's very specific. And concerning the religious freedom angle, yeah, it's true that religious persecution or religious conflicts are often based on several layers or levels. The first one is basic social, which is intolerance. then discrimination, and then even persecution. Minorities are frequently targeted as those who are problem makers, as those who represent kind of difficulty for society or problem of homogeneity. And we need to change it, because of course we are all somewhere, sometime, somehow parts of minorities, but on the other side and the major side, we are all one nation, one society, or one mankind. I think that this understanding, as Marco also mentioned about dignity, is a conceptual one, because in dignity we are all equal. Whether we come from Europe or Asia or America, whether we come from royal family or homeless family, we are all equal in dignity. Nobody is more, nobody is less. But, and this is the principle of creativity, everyone is different. My son is different from me. In this sense, this diversity, it's a principle, it's definition, it's not a problem. And therefore, we need to nurture this understanding in our communities, in our societies, that we all are different. We all have also differences in our views, in our worldviews, in faith, in convictions, but we are one humanity. And I think that this momentum now is very special, and I would like to say fruitful, for this understanding. I invite, and when I can, I really address different sort of leaders or representatives, whether religious or political or civil, governmental, non-governmental, to share this understanding and to act accordingly. One of the concepts which we need now again to renew or strengthen is bonum commune, common good. This was the answer to European and the global tragedy of the Second World War, including Holocaust, including other issues I don't want to deal with now. This common good, win-win approach, shared interest, delivered really peaceful and quite prospering community in Europe. So either we get back to the origins of these answers and principles like human dignity for everyone everywhere, or we will find more and more conflictual 21st century. I hope that this religious dimension will help to wake up understanding and shared responsibilities, because common future is here, or common world is here. But we need to understand that there is common ground, there are common values, there are also common interests, especially now in Corona time crisis.
Thank you, Jan. And also just briefly commenting also on the question of what specifically action points we could call for. There was another question that actually was phrased as a question, but proposed one of potential solution, and that was to call for the liberation of prisoners of conscience, for example, Baha'is and other religious minorities in Iran or Pakistan. And indeed, this is something that a number of actors have already called for, including Ambassador at Large for International Religious Freedom, Sam Brownback, including Yusuf as well, including a number of British parliamentarians calling upon the Pakistani authorities to follow up on that as well. So I think there are definitely many action points that could be mentioned here, and of course we can engage with this question a little bit more. But also,
good news, Evelina, on this, because the appeal to release religious prisoners or prisoners of conscience, which was released by the Ambassador Sam Brownback and shared by several other countries, is one of the let's say, introductory actions of newly established Alliance for International Religious Freedom, which started its existence in early February. And it's quite promising community of currently 29 states, which are like-minded and committed to do more than we did in the past. And we need such protagonists, not only in America, not only in Europe, but elsewhere. And those protagonists should unite on concrete items or issues. This one on prisoners of conscience is very special, specific, and constructive one. Thank you.
Yes, and I think you made a very important point that we need those protagonists, and we need those protagonists protecting and engaging with the right to freedom of religion belief at the domestic, regional, international level. And of course, over the recent months and recent years, we've seen a number of specific mandates being created for individuals who are dealing with the right to freedom of religion belief at the domestic, international level. And of course, your mandate at the European Union was one of them. And my question would be, what is happening at the European Union, and whether there is any kind of willingness to continue with this important mandate? Because of course, we can't underestimate the importance of such mandate at the European Union.
My mandate was reflected and discussed very positively or constructively at the end of last year in October in Brussels by governmental and non-governmental representatives of many European Union countries and institutions. After the takeover by the new Commission, there is still no decision made or signal on either continuity or discontinuity. So for me, it's not easy to comment. But I think that all this agenda and introductory 3 years have been response to genocidal situation in the Middle East. And we cannot only react, we cannot only do something when there is a fire. We have to prevent, and we have to build better prospects for minorities, majorities living around the European Union. This is our interest, but also responsibility. So I hope that current European Commission will make a reasonable step in order to boost this policy, to step up efforts, and even to continue in something what started as pioneering work, being at the beginning questioned whether it's okay or not, how it will work. It was very good beginning. After 2016, when I started, as you recall, several European countries followed this example, and now we have envoys, ambassadors, or special representatives in Denmark, Germany, United Kingdom, Lithuania, Poland, Hungary, Czech Republic, Netherlands, and so on. So this is direct proof that this policy matters. It is important for member states, and it should be important also for the community, which, according Robert Schumann's message or legacy testimony, should serve as a leader of humanity, not in competition, but in cooperation, in cohesion towards more humane 21st century.
Thank you. And of course, Brett mentioned a very important document that we have, and you receive also a link to have a look what Punta del Este Declaration on Human Dignity for Everyone Everywhere is all about and how you can get involved. But I think a very important question to Brett is, what can we do with it? Of course, it's a very important document supported by so many academics from all over the world, politicians and experts. But how can we promote it, for example, at the UN or with governments at the domestic level?
Thanks, Evelina. You know, I think that to some extent, the Punta del Este Declaration was an effort by academics and human rights activists, religious leaders, political leaders, to simply try to reassert and renew the commitment to human rights that we see under stress in a lot of ways. I mean, before the coronavirus crisis, there was a lot of talk about, are human rights really universal? Are they overly ambitious? Can they really help us solve the problems that ail us? And one of the things we're hoping to do at the Punta del Este Declaration is simply try to renew and reinvigorate human rights discourse. I think there may be some possibilities for some sort of follow-on declaration that is at the state level that could take place at the United Nations. There are conversations going on in places like the Organization of American States about the possibility of doing a resolution focusing on human dignity. There's also a good idea which has been circulated to appoint a special envoy for human dignity at the United Nations, or a special rapporteur, something similar to what we have for speech and for freedom of religion and belief. I think these are good ideas that deserve additional thought and support.
Thank you, Brett. We also have a few important questions in relation to the right to health and how it also relates to human dignity. And the question is, the right to health is a very much focus on physical health, the right to religious freedom on spiritual health. And perhaps we could suggest that they are equally important for dignity. And maybe if we could start with Marco, please.
Thank you. Thank you. This is a very important question. Jessica from Oxford asked this question in our Q&A. And again, what we observe now is not detached from a process which was going on before, which will now continue, possibly amplified by the crisis. And that's the process of redefinition of what health is about. And we know from bioethicists who's been observing the crisis about their concern for palliative care, for end-of-life care. I mean, this has been, of course, this will, in the end, will be seen as a great time for understanding the importance of those. But at the same time, this is also a time when a lot which had been done in the past has been overwhelmed, has been undermined by the overwhelming basic needs of the crisis. And so the very definition of health is at stake, health and well-being. And you know, the very importance there of technologies, and what we have, there's a lot of work ahead in terms of how to involve artificial intelligence in healthcare. Nancy mentioned the European framework for data protection, what we call the GDPR. Well, that's a very important case. That's a great example, but it's also an example which tells us about another dimension which we need to take into account. And that dimension is that there are tensions, there's competition, there's disagreement. And in fact, one of the basic challenges is about how we handle diversity. And we know that for all our convergence on great principles and for all our efforts to build this convergence, there are basic tensions and well, dignity of the elderly and forms of, you know, euthanasia and whatever, that's a big, you know, there are fundamental questions and there are fundamental disagreements in our societies around that, as we also have for all the apparent agreement about freedom of religion or belief. So let me point specifically at this. There is a challenge in terms of competition, and the GDPR for the European Union is a matter of competition. And as we will be facing a crisis in the economy, competition between regions and actors will be there, and we will have to face this. And GDPR is the distinctive frame not only of protection of dignity and human rights for the European Union, but it's also a distinctive competitive frame, especially vis-a-vis the US and China as it comes to data protection. So the ultimate test of human dignity will be also about how competition will be sustainable, in fact.
Thank you very much, Marco. And of course, we don't have much time left. I would allow only one last very brief question. I think mostly because it also relates to a number of issues that I mentioned at the very beginning, and in terms of how some religious minority groups are being blamed for the spread of COVID-19. And the question relates to the recent UN Secretary General Antonio Guterres' statement that our fight against COVID-19 pandemic is a dangerous epidemic of misinformation. And of course, this spread, the spread of misinformation leads in turn to further increase of fear, stigma, and discrimination among faith communities. And how can faith communities together find effective ways to address this? And if I may go to Jan first.
Yeah, it was interesting and important message from Antonio Guterres. And I think that it was in a very special time, important as a religious holiday for Christians, for Jews, and now also for Muslims. So somehow Antonio Guterres not only realized, but expressed importance of religious communities and leaders to share hope, to share fraternity or brotherhood, which is actually expression of basic human rights. Universal Declaration speaks about duty of fraternity, to behave in the spirit of brotherhood. And now in time of real, painful, visible crisis caused by invisible enemy, we are tested in this understanding of universal rights, of universal human family, and also dignity which is connected not only with rights for everybody, everywhere, but also for duties for everybody and everywhere. So when this understanding is now better promoted, presented, implemented by leaders, but also by all, I think we can get out of this crisis sooner and getting stronger. And that's something very important, because if crisis brings new maturity, new level of awareness, this will be a productive time for all of us. I already used the European example that we got out from the major tragedy and crisis with totally innovative approach, which was a supranational community working, existing, and now being again tested. So I hope that we will make this test successfully.
Thank you, Jan. Unfortunately, we don't have much time left, and I would like to use the next 1 minute to thank our panelists for spending this time with us and for sharing their great expertise, knowledge with us on the important issues pertaining to religious freedom, freedom of religion belief, human dignity, and COVID-19. And also I would like to thank all participants or attendees for sending their questions, for participating in this webinar. And unfortunately, we're not able to respond to all those questions. I'll make sure that Francesco can share my email, or if other panelists are willing to respond to some of the questions, we can always do that in due course as well. And now I would like to give the floor to Francesco, because he would like to share also the results of our polling that was done earlier today.
Thank you, Evelina, and thank you all the speakers. Before then, I'd like to ask if Pasquale would like to comment or share his closing thoughts before we end this connection. Pasquale. Pasquale, you're muted. Pasquale, we cannot hear you. You need to unmute yourself. Okay, unfortunately, we cannot hear from Pasquale. Pasquale is one of our hosts, and we would have liked to hear from him. Well, thank you so much again to all of our speakers and to Evelina for having moderated this panel so well. I haven't mentioned at the beginning that this series is organized by the Cambridge Institute on Religion and International Studies, the Center for Religion Studies at Bruno Kessler Foundation, the Center for Justice and Society at the Fundação Getúlio Vargas, the Law School Rio de Janeiro, the International Center for Law and Religion Studies at Brigham Young University Law School, the European Union Office of the Church of Jesus Christ of Latter-day Saints, and the University of Siena. This has been excellent. Has been excellent to have you and to hear from all of you. Again, this time we have seen people from all over the world joining us. We were about 150 people at one point during the connection. We look forward to see you again next week on Thursday at 3 p.m. Central European Time. We will have a panel on focusing on the approach of civil society organizations. And the panel that is lining up is going to be very exciting. And more information will come through our newsletter and the landing page of our webinar series. So once again, thank you all to all of our speakers and to all of you for joining. And we wish you a wonderful rest of the week and a good weekend. See you next week.